continuously tries to communicate with us. It tries to tell us so many things. In fact, it is ready to open up and give us all the secrets which are happening inside each and every organ of our body. It's our responsibility to understand what body is trying to tell us. For example, a simple thing like pulse. What can we infer from a simple, very simple thing like pulse? Every one of us can examine our own pulse. And when we examine our own pulse, there are so many factors which can influence the rate of the pulse, the rhythm of the pulse, the volume of the pulse. And even when you are feeling this pulse, you are also feeling that artery. When you are feeling the artery, you can say whether the artery, that particular artery, along with it, other arteries are healthy or not. Just by touching your wrist with your fingers and feeling the pulse, you can know so many things, what body is trying to communicate with you. So normal pulse rate is 70 to 90 is fine. It's normal. But if it is more than that or less than that, then it is a problem. What is actually pulse? What do we know about, while you are feeling the pulse? Generally, we can feel the pulse in the wrist. Below the wrist, there is this radial artery. Below the thumb, if you can touch your wrist part, forearm, you will be able to feel the pulsation. No screen sharing. I will try to share something. Yes, just a moment.
Recording in progress.
Hello.
Yes, by audible.
Yeah. Okay, I think my screen is visible now.
Yes, G, it is visible, clearly visible.
So the general thumb rule is 70 to 90 is normal. Below 70 or above 90 or above 100 is abnormal. So what does this pulse indicate? Heart tries to pump the blood, and this blood goes through the arteries. And whenever there is this pumping thing happening, so forcefully the blood enters these arteries and it exerts a pressure on the walls of these vessels, arteries. So that causes pulsation. So if heart is pumping the blood normally without any disturbance, then we will not find any problem. But if the heart is not functioning properly, it is putting a lot of strain on itself, or it is not working properly, it's working slowly or fastly. All these things are indications of some disturbance in the health. So we measure generally three things which you all can do. One is the rate, how many times heart is pumping the blood in a minute, and then rhythm. Generally the rhythm should be normal. If you are counting for 60 seconds, so first 15 seconds, if the rate is around 15 times, next 15 seconds it is 30 times, next 15 seconds it is 10 times. Like that, if the rate is changing, then it is not rhythmatic. So we need to see whether the pulse rate is rhythmic or not. Similarly, if the pulse, when you feel it, you can also feel the volume of the pulse. If it is full, you can feel the pulse properly. Volume is good, heart is pumping properly. If the pulse volume is very feeble, so heart is not able to pump properly. So feeble pulse is an indication of some problem in the heart. So you need to check the volume, you need to check the rhythm, you need to check the rate. This every one of us can do, and we don't need any instruments to check this. And one more thing, particularly people above the age of 40, they can start feeling that radial artery regularly, and when you touch the artery and you press it against the bone underneath, if you can feel the artery like a thick tube, that indicates thickening of the walls of the vessel, thickening of the walls of artery. So if you can feel that the artery vessel is thickened and you can feel it, normally you will not be able to feel it. Except for the pulsation, you will not be able to feel the artery. But if you are able to feel it, then it is a problem actually. So it indicates that the vessels are becoming thickened, at some point of time, at some place, these thickened vessels, the lumen will become narrow and the flow of the blood will become difficult. And if that happens in any vessel in the heart, which supplies blood to the heart muscles, then it can be a severe problem. So if you can feel the artery on your radial bone, then it is high time you need to consult a doctor and do something about your particular artery. So this is something which we all can do. So we need to understand that when the heart is forcing the blood through the arteries, so you will feel this beat firmly, when you are pressing your fingers on the arteries. So for example, I have given you the radial pulse. So you can also find this pulse on the side of the neck or inside the elbow. So wrist is the common place where you can easily check. You can check your pulse, you can check other people's pulse. When you are checking the pulse at your neck, lower neck region on the side, if you are pressing it, you are stopping the blood flow to the brain. If you are checking it on both sides simultaneously, you are stopping the blood flow to the brain completely. So you should some people try to feel the pulse on both sides of their neck simultaneously. That can cause a problem. So never do that. So you can just use your fingertips and press them firmly on the arteries wherever, on the neck side, neck or on the wrist, and you can count the pulse for 60, and you'll be able to understand what exactly is happening with your heart. So then nowadays, all of us have smart watches, which will actually easily tell you the pulse rate, heart rate, and blood oxygen concentration. Easily, SpO2 is being measured by these smart watches. Mostly accurately, they are measuring. So they will tell you exactly what is happening with the pulse rate, but they may not tell you about the volume. They may not tell you about the um, rhythm and all those things, that you can feel it by yourself. So apart from that, when we are speaking about the pulse, we are actually trying to understand about our heart. Similarly, we can try to understand about our heart more by understanding blood pressure. Nowadays, these smart watches are also measuring blood pressure. Previously, people used to use these digital blood pressure monitors, which will tell us the blood pressure. What is blood pressure? Again, blood pressure is the force of blood pushing against the artery walls. Force of blood pushing against arteries. So when the heart is pumping the blood, this blood puts pressure on the walls of the artery. So that pressure we measure in millimeters of hemoglobin, millimeters of mercury, mm of Hg. Okay. So generally we say 120 by 80 is normal. So what is this 120? What is this 80? So this 120 is called systolic blood pressure, systolic. And 80 is diastolic. So when the heart is trying to put pressure on, pump the blood, and this blood is putting pressure on the arteries. So that pressure, when the heart is pumping, that is called systolic pressure. So generally this 120 thing, the higher number is the pressure inside the artery when the heart is contracting and pumping the blood through the body. So this lower number, diastolic, it is the pressure inside the artery when the heart is relaxing, it is at rest, it is not pumping. So heart is trying to fill itself with blood, so it is not pumping. Then the pressure on the artery's vessel wall is less. That is diastolic pressure. So both the pressures we record. So generally 120 by 80 is normal. So normal manual blood pressure measuring machine is called sphygmomanometer, which is generally accurate. But nowadays the digital ones are also good, maybe plus or minus 10 units. So if this blood pressure is increasing, what does it indicate? because we know that if the hypertension happens, the blood pressure increases, there's a risk of heart attack, the risk of heart failure, there's a risk of stroke. Means when there is more pressure, these arteries are having more resistance against the flow of blood. So heart is pumping harder and harder. So because heart is doing more work, sometimes heart can fail. That is what we see nowadays. So what is normal blood pressure? Generally, it can be different for everyone, but normal, generally 120/80 is normal. And when the systolic is more than 120, greater than 120, and less than 129, and diastolic is still less than 80. So we call elevated blood pressure. If it is greater than 130 and diastolic is greater than 80, so then it is called, we can say it is hypertension. We can say stage 1. Stage 1, high BP. Stage 1, high BP. And if it is greater than 140, and this is greater than 90, systolic is greater than 90, systolic is greater than 140, diastolic is greater than 90, that is stage 2, high blood pressure. So please use these numbers just like a guide. And if you get a BP machine and you try to measure and it is showing higher values, only one single measurement will not indicate that you are having hypertension. So multiple times, if you go to a doctor, he will not just diagnose you with hypertension just by measuring it one time. So multiple times they will check blood pressure in different scenarios. And then if they think that you need medication, they will give. But luckily, we in our hospital, we treated many patients without medicines. We try to help them overcome this high blood pressure by strengthening their hearts, increasing their blood circulation, doing some detoxification therapies. We were able to make people stop using antihypertensive medicines forever. Normally, when you start antihypertensive medicine, doctor will say you have to use it for longer duration, probably lifetime. But we have some really good medicines and therapies, and along with the pranayama and meditation, all these things will together help us get rid of hypertension medicines. So it's good if you have a digital blood pressure monitoring machine or a wristwatch, smartwatch, which can measure your blood pressure, heart rate, heart rhythm. All these things will help you tell if your heart is working fine or not. So then I will also try to draw your attention towards another important measurement which you can do yourself. So see, to measure your blood pressure, you need some kind of instrument. Okay, but this thing which I'm going to tell you is you can measure this particular parameter, which is very important. That is respiratory rate. Respiratory rate. Just like pulse rate, you can measure respiratory rate. Number of times you breathe in 1 minute is a respiratory rate. Normal is actually 14, maximum 16 times per minute. So we can just simply observe our breath, observe our lungs, observe our chest, and we can count how many times we are breathing in 1 minute. 12 to 16 times is normal. You know, sometimes respiratory rate can increase in special conditions like fever, illness, stress, or you did a lot of physical activity. But normally it is 12 to 16 times. I will give you a interesting, fact about the respiratory rate of tortoise. Tortoise or turtle, it's around 4 times per minute. 4 times per minute. And if you take another animal like dog, it is around 30 times per minute. So why did I do this comparison? If you look at the lifespan of human being, it is around 100 years. Though everyone is not living up till 100 years, our body is designed to function normally for 100 years. Even a tradition, people, elderly people, they bless us, Satamanam Bhavati, which means you will have full lifetime, 100 years, like that. So 100 years is our normal lifespan. For tortoise, it is more than 300 years. Some turtles, they live for 400 years also. And for a dog, about 15 to 18 years, maximum 20 years. So you can see that the respiratory rate is inversely proportional to the lifespan of an organism. The more your respiratory rate, the less you live. You can say we have fixed number of breaths and we consume them, we die. See, this tortoise reference is very interesting. In our literature, tortoise was given a unique place. In fact, in Bhagavad Gita, Lord Sri Krishna says in the 2nd chapter, 58th verse, Yada samharte chayam kurmo anganeva sarvashaha indriyan indriyadhebhyas tasya prajna pratishtita. So the person who tries to remove himself from the worldly senses, just like tortoise removes himself, withdraws its limbs and goes back into the shell, goes back into itself. Like that, if you can go back into yourself, go deeper into yourself, remove yourself from the present world and go back into yourself, then you will become, successful in so many ways. This is what Lord Sri Krishna says. And there are so many other references, like in Tiruvalluvar's Tamil, literature. So many other places you will see that tortoise has been given a lot of importance. And this movie called Kung Fu Panda. So the panda's guru is there, and guru's guru, who is the ultimate master of this Kung Fu, it was represented by tortoise, because this tortoise is very cool, calm, active, like that. So why is this symbolic, this thing? Not just in our culture, not just in Western culture. If you can see other countries, in China, they teach this special breathing called tortoise breathing. Tortoise breathing. This term is, there is a Chinese term also for this. I don't remember it, but they say tortoise breathing. They deliberately make people breathe like a tortoise. They say more breath per breath. More breath per breath. So instead of breathing so many times in a minute, you breathe less number of times and take in more air. So this tortoise breathing helps in longer lifespan. That is what Chinese people, they believe. Someone is asking when the pulse rate is more than 100, BP is 60 to 70, 100 to 110, and does not observe any uncomfortness, discomfort. Is it okay as doctors say that till the difference is maintained to 40, it's not a matter of worry? See, again, these whatever ratings we try to measure, they are unique for everyone. And sometimes some people, their BP is normal. For example, my BP is always 100 by 70. Always. Anytime you measure it, it is 100 by 70. So, and I'm fine with it. I don't have any ailments. I don't have any problem. My heart is functioning properly. So this can happen. For some people, maybe 130 by 90 is normal without any symptoms. So there are so many other factors to know whether we are healthy or not. For example, if you are doing some physical activity, are you able to do it, or you are gasping for breath? There is sudden change in temperature, rise in temperature, fall in temperature. Your body is able to withstand this change in temperature, change in weather, change in seasons, or not. Suddenly you have to wake up whole night or do some extra work, sleep deprivation happens. This change in lifestyle, suddenly, is it affecting drastically, or you're able to do with cope up with it if the differences are only minor, only for few days? So all these things indicate whether you're completely healthy or not. So if you are healthy, you need not worry about it at all. If you are able to withstand stress, withstand physical strain, withstand changes in temperature, you are not catching all the diseases from other people. All these things are indications that you are healthy. So then, and there is no fluctuation. Suddenly, drastically, it is not going down to 100 by 60 and then going up to 140 by 80. These fluctuations are not there in pulse rate or BP and all. If it is being maintained normally, that is okay. So, and Geeta ji, you want to ask something?
Sir, good evening.
Good
Namaste.
evening.
So I wanted to tell you that when I have some extra work, like for instance, if there is a 1 week program or if there is a 3-day training program that I'm doing, I find that normally I am okay. I have a pattern. I kind of do my things in a very scheduled manner. But when such things happen, after that it takes a while for me to again get back to normal. So maybe I don't know. You just now said I thought I should.
Yes.
Mm,
So if your body is not able to cope up with the altered lifestyle or schedule,
yes.
uh, and it is giving up, it is demanding more rest, or suddenly it is getting some kind of aches or fever or something like that because of the changed life pattern, then it is an indication that you need to be more careful and more responsible towards your body. Do something more to take good care of your body.
Because right now, just now, a couple of months back, 2-3 months back, we shifted our residence, and then I'm traveling now for a longer distance.
Yes.
So it took some time. Now I'm slowly settling down with the new schedule. So it takes a little while for me to settle.
That's okay. Taking some time to settle down to your new schedule is okay. But the sudden changes should not bring a sharp change in the health level, well-being level of well-being. They should not cause any sharper problems, acute problems.
Yes.
That's what we need to be careful about. That's all.
Yes. Yes. Thank you, Doctor.
You're welcome. So now I'm just speaking about this tortoise breathing. More breath per breath. So, we need to understand the right way of breathing. In fact, we use less than 20% of our lung capacity. We take less oxygen, which is very important for vital for our well-being. So why do we do that? Because we are not consciously training ourselves. Nobody taught us how to breathe in the right way. Nobody told us how much air is necessary to maintain optimal health. So now after Corona, people know that when you are taking less oxygen, the blood oxygen concentration is falling down, and you are gasping for breath, then it will be unhealthy. Like that, now people know. In fact, many people, they were giving some oxygen to some family member at home using an oxygen concentrator or an oxygen cylinder, and they are controlling the oxygen, how much oxygen flows through the oxygen mask, like that, and they're calculating how much oxygen should reach, like that, all those things. So, but this is all after Corona. Previously, nobody spoke about these things. How much oxygen we need to take, how much air we need to inhale. Normally, when you are inhaling properly, you can at least take 2.5 liters, 2.5 liters of air. This is what you can breathe in one inhalation. But unfortunately, less than 500 ml of air is being taken on an average. Means we are using less than less than 20% of our lung capacity, which is sad. Why do we do that? Because nobody told us the right way to breathe. So breathing in slowly and deeply till it reaches the lower part of the lungs and lungs expand and double their size. That is the right way to breathe. That is called abdominal breathing. Abdominal breathing is very, very important. So generally we do shallow breathing. That's why respiratory rate increases. And when the respiratory rate increases, our health decreases. So you just remember this mantra, more breath per breath. When you take more air, take deeper breath, abdominal breathing. This will increase the oxygen delivery to vital organs, and it will reduce this oxidative stress. When the oxidative stress comes down, your mind becomes calm and tranquil. Breathing through the abdomen, expanding the abdomen and chest, allowing the lungs to expand and taking deep breaths. This breathing is called parasympathetic breathing. And when you do that, the heart rate also comes down and you relax physically and mentally. Breathing pattern, generally, you will see that the breathing pattern changes in different situations. Like you face anger, stress, fear, there's some kind of disturbance inside your mind, irritation. Then your breath becomes shallow. When you are anxious, it becomes rapid and shallow. This breathing center is in the brain, exactly in the brain stem. It's lower part of the cerebrum. So when human beings breathe, generally they breathe unconsciously. So generally while sleeping we breathe, it happens unconsciously, but actually while sleeping you expand the lungs better than what we are doing while you are awake. This inhalation, taking air inside, is like doing some effort. We need to do it consciously. Consciously, we need to observe what's happening. If you are full of anger or stress and all, if you just observe your breath pattern, you'll see that there is shallow breathing while you are stressed out, irritated, angry. Breathing is shallow. Then you hold the breath for a moment till you gasp for air. Then you start doing this abdominal breathing, not the chest breathing, abdominal breathing. See what happens. This chest breathing or shallow breathing is sympathetic breathing and involuntarily happens. But when you are consciously doing it, it is parasympathetic breathing. So when you observe and deeply, slowly you take the breath, you will see that in an instant, within a moment, you will be able to come out of that anxiety, stress, anger, and you will be able to calm down your mind. So taking this air, deep air, it removes this carbon dioxide will be removed from your body. If the carbon dioxide buildup happens inside the body, it causes increase in the acidic pH of your blood. When you breathe properly, it makes the pH of the blood alkaline, which is good. So remember tortoise, 3 to 4 times per minute breathing. So you can also practice this tortoise breathing. So generally, how they teach this tortoise breathing in China, they ask you to take deep breath, try to expand your abdomen, allow the lungs to expand, take deep breath, and then at the end of the breath, swallow the breath as if you are swallowing some food. After swallowing your breath, then you again slowly breathe out. So you can do this, you can practice it whether you are sitting or while you're lying down. So take a long breath, slowly inhale, deeply do the inhalation till you can feel that air is till your neck. Then you swallow it. Then deeply exhale, slowly, not through your mouth, exhale through your nostrils. So always it is good to breathe through your nose, because when you breathe through your nose, it traps the dust particles, it adds some warmth instead of cold air damaging the lungs. It will add some warmth. It will also add some moisture to the air. If you are sending dry air to the lungs, they can damage the lungs. So warmth, moisture, filtration, all these things happen when you breathe through your nostrils. It's always advisable to breathe through your nostrils, exhale through your nostrils, because breath is life. We say pranavayu. In Sanskrit language, we call it pranavayu because it is life. The better you breathe, the more energy you will have. So taking deeper breaths will bring in more oxygen to the body, improve your energy levels. And when deep breathing happens, the stress levels come down. Digestive system becomes strong. Your digestive fire gets rekindled. So slowing down the breathing rate and taking deep breaths, abdominal breathing, parasympathetic breathing. So it will help the body to recuperate, regenerate, revitalize, heal itself. So when you are doing deeper breaths, there will be less inflammation inside your body. It reduces the acidity level, as I've told you earlier. Someone has written the alkaline pH of the blood. So body becomes more alkaline, not just the blood. Entire body should be alkaline, slightly alkaline, is healthy. And when you are doing more breathing deeply with awareness, you will be in the present moment. You will be connecting with your intuition, internal teacher. So you'll be listening to your inner voice. You'll be awakening the hidden potential inside. And of course, when you are breathing deeply, your mind is relaxed, you're calm, you're not reacting, you're responding to various situations in life. So your relationship with your friends, with your relatives, with your family members will be great, because you will not react, you will respond. So it's always good to have this deep breathing regularly. This is something we can all practice. As I've told you, just remember tortoise. So, uh, in even not just in Bhagavad Gita, in Tirukkural from Tamil Nadu, it says, if a man learns to control his five senses in one birth, like the tortoise, that power will stand by him in his seven future births. And they say that in another Tamil this thing, they say that by doing yogic practices and controlling the breath, you can live up to 1,000 years, longer than a tortoise. This is a reference from one Tamil text. So longer than a tortoise. They know that tortoise live longer just by controlling the breath. So we have 100 years of span, and we can live happily without any ill health, just by observing our breath, just by doing conscious breathing. So, a funny example is like you have 15 times per minute breaths, or maybe 18 times. So, average you take 15 times. 15 times you breathe in 1 minute. So, in 1 hour, it's around 900 times, which means in a day you're breathing for around 21,600 times per day. So when you are slowing down this breath rate, so you are increasing the lifespan. So instead of 21,600 times, if you are breathing lesser times, you will be living for longer period with more health. There is this Chola king who built this Nataraj temple in Chidambaram. So he has placed 21,600 golden tiles in the roof of this Nataraj temple. So it's very, important number. Paramahamsa Yogananda, writer of this autobiography of a yogi, he says the restless monkey breathes at the rate of 32 times per minute, and man's average is 18 times. An elephant, tortoise, snake, and other animals noted for their longevity have a respiratory rate which is less than the man's. The tortoise, for instance, may attain the age of 300 years, breathes only 4 times per minute. So this is directly from, quoted from Paramahamsa Yogananda's written works. So if you can live for 100 years by breathing 15 times a minute, instead of 15 times a minute, if you increase your breath rate to 18 times a minute, then instead of 100 years, you will live only till 83 years. So instead of 15 times, you breathe only 2 times per minute. So instead of 100 years, you can live up to 750 years. Breathe only 1 time per minute. You can live up to 1500 years. Just a funny calculation. But see, our yogis, they have practiced this art of bringing down the breath rate and bringing the whole metabolism to a pause. And that is called the samadhi sthiti. So this samadhi sthiti helps us slow down. There is this Ashtanga yoga, 8 steps of yoga. Yama, Niyama, Asana, Pranayama, Pratyahara, Dharana, Dhyana, Samadhi. So these 8 steps of yoga, the last step is Samadhi Sthiti. And in this Samadhi Sthiti, people can slow down and almost make the respiratory rate to 0 and pause the metabolism. And we know yogis, I personally knew a yogi who lived for more than 300 years. I know a yogi who can lift himself, levitate himself while practicing pranayama. I have seen him doing it. So, see, you might be knowing about hibernation. Hibernation. Bears, rabbits, they go into hibernation. They go underground and they don't eat anything. They don't spend energy. They don't consume food, all those things. So this hibernation is more like a samadhi sthiti. And our yogis are masters of this samadhi. So what I'm trying to tell you is just by bringing down this metabolism, slowing down the metabolism, you are slowing down both the things, both anabolism and catabolism. Anabolism is construction of body, tissue building and everything, new cell production, all those things. Then catabolism. Catabolism is destruction. So both together comprise metabolism. So both of them happen. When anabolism is happening more, your body grows, particularly in the young age. And when catabolism is happening more, you grow old, your body degenerates. In the middle age, both of them are in balance. So, but still they are happening continuously. The body, we call body as Sarira. Sarira in Sanskrit. What is the definition of Sharira? Shiryate iti Sharira. Shiryate iti Sharira. What is Shiryate? Shiryate means continuous degeneration. Continuously withering away. So that is the nature of body. But still, we can slow it down. We can slow down the aging process by slowing down our breath. So it's very important for us to understand this concept and put it into practice with full awareness. How do we do that? We can take help of some simple techniques like, breath check triggers. You can keep certain activities in your day which you will do every day, and those points you can keep them as triggers to check your breath. For example, when you are taking bath, when you are brushing your teeth, when you are when you are about to have lunch, dinner, breakfast, when you drive, when you do some physical activity, many things. Or you can keep some 5 or 6 things, and whenever you do that, you will make a habit to check your breath while doing it or before doing it. Before sitting for lunch or dinner, observe your breath, observe your mental state and observe your breath. And if it is disturbed, take deep breaths and see the change in the mental state. Once your mind settles down, it becomes calm, then you have your dinner. Before driving your car or bike, just observe your breath. If it is shallow, if it is rapid, if it is quick, slow it down. Take deep breaths, then you start driving. Like that, when you're doing an important work, you're making working on a new project or attending an exam, whatever you're doing, slow down your breath, make it relaxed, then do it. Or you can do another important thing. You can just print small stickers, or even just make some stickers, cut some cardboards and write, observe your breath. Observe your breath. And put this in various places, like on your dashboard, car dashboard, or on your desk, or on your bathroom door, switchboard, washing machine, refrigerator, main door, everywhere you can put. And whenever you observe, whenever you look at this sticker, take a pause, observe your breath, observe your mental state, and then slow down your breathing pattern, and then take deep breaths and see what happens. So, this is something we all can do. And I can assure you that results will be instantaneous. Instantly, when you are under stress, just by changing your breath pattern, you can come out of that mental state. And in the long run, you will be helping a lot. Doing conscious breathing is the best gift you can give to your own body. So it is our responsibility to take good care of our own body. So doing conscious breathing is the best gift. We all can do this. So let us all determine that we all will do this and increase both our physical and mental health. Someone wanted to ask a question. Prashant Swamiji, you can switch on your mic and ask the question.
Bhaiya, namaskar.
Namaste.
I think this was very wonderful thing that what you explained regarding the nerves and even the pulse and all the other things.
Yes.
But what we are doing is we are doing the dog breathing as well as the one more Shashank Asana we say.
Yes.
And other breathings. And in the sessional, we say that sectional breathing with the stomach, with the chest, and with our upper region of this.
Yes.
Yeah. So these all actually very, I'm pleased to tell also that we should also definitely do, and we should also make our students also to do.
Yes.
And it's very difficult to complete this in the SIP when we are conducting for the first year or say second year.
Yes.
And for the same, what I did is I'm carrying out a research work presently on the students of engineering, all streams.
Wonderful.
So we are trying to work out on the effect of Surya Namaskar and DRT, that is a deep relaxation technique on the anxiety.
Oh, wonderful.
Yes. So anxiety. Actually, I wanted to take the topic of that cortisol, but our guide didn't allow me. But I am doing on my own that also. So
Okay.
actually, first test we have taken also of the blood test of the students with their permission.
Okay.
And we got the results, and I found that the students little bit means we took the thyroid also. And from that, one of our dada is there who is a yoga expert. So we found that if the thyroid level from that, even we can judge how the student is, whether he is fat or he is normal or abnormal, we can say like that.
Yes.
And we are trying to our best to work out that with this Surya Namaskar and DRT, that is a deep relaxation technique, and the Omkar chanting, how we can make the students bring down their anxiety. And now almost I have completed my 13 days or 42 days.
Okay.
Continuously early morning 6 to 7 we are taking. I'm going to college.
Oh, in the college,
yes.
live,
Yeah.
like not the
And
online.
this UHV. Yes. No online, offline.
Okay.
And this UHV has helped me a lot. I actually very much thankful, because what that 5:30 session I'm joining,
Yes.
but I 6 o'clock.
Yes. Hello.
Due to that only, I could now wake up at early morning 4 o'clock, and then even if I go little late, also 11 o'clock bed, I wake up without any of the alarm. So for the sake of the students, we can say, and something we have to give to the this our society, and the next generation should be the best. And what I'm finding is the students. I asked today only one of a few students that what do you feel? What is the change that you are finding in yourself? So I got a very good answers from them. No doubt about the happiness. They are very much happy also. But as they are telling, so I got cooled down. my whatever that anxiety part. Due to that, I was speaking a lot. Now I am thinking and then I'm speaking. So these answers are wonderful, awesome, we can say. And
Yes.
really this works. Really this works. But here some thing that has to be understood is every teacher has to take the initiative, and then only this can be a in a big what you can say, the big work can come in a means good way.
Yes.
So that is
Very
what my explanation actually. And Bhaiya, thank you Bhaiya. So your this all, even we are telling to the student that tortoise, as you said, 350 years, dog
yes.
15 to 18 years only. And really this works
Yes.
great. You're telling them
Yes,
also. Yes, yes,
great,
yes.
Prashantji. I'm so happy that
Mhm.
you are guiding your students, and this is the need of the hour.
Yes,
Teachers,
yes, yes, yes.
we all should take this responsibility of guiding the next generation, so that
Yes.
they will be, traveling in the right path. It's not just physically fit or not something like that. This will guide them in the right path spiritually also. So,
Yes, yes, yes.
so,
We are
so
taking these mantras also. I am taking the so Shanti part, then Pratasmaran,
yes.
then our Sahanavatu Prarthana, and lastly the Sarvabhavantu, the all these things. And chanting is also there, three Omkar chanting. So everyone, and it is not mandatory. Is that is sorry, it is not compulsory to anybody. But now I am finding the students are joining a lot.
Yes.
Earlier I told who want to join can join interestedly, but now that interest had developed in many of the students. They are coming on their own. I'm not forcing them. So that's a good sign. We can say out that they are coming
And
on their own.
the research part is more exciting. Like you are checking
Yes,
the
yes, yes,
thyroid
yes,
levels, cortisol levels, is all.
yes, yes,
I know this
yes,
is
yes,
something which is also very important. And I
yes,
will also
yes, yes,
suggest you, to encourage your students to sleep early before 10, so that the melatonin secretion happens properly inside their body, and not let them expose their body to artificial light
yes,
after 10
yes,
o'clock.
yes.
And there you can also do some research. Like here in Visakhapatnam, there is this Atal Tinkering Lab in some schools, and one of the mentors, he is ready to
Yeah.
do some research on this particular part of
Okay.
you want to take a sample of students who are sleeping after 11 p.m. and a sample of students who are sleeping before 10 p.m. and various
Yes, yes.
parameters we want to test, and all those things we are just to, I
Mm-hmm.
want to tell you one simple thing. In that particular school, we have suggested the students to take up a project on this melatonin, this thing, how melatonin production gets reduced by 50% just with the exposure of artificial light for half an hour after 10 p.m.
Okay.
So,
Okay.
so we wanted them to demonstrate with some model, and they went to their
Okay.
biology teacher to ask for permission, and the biology teacher denied permission, saying that this is not true. I never heard about it. What is the scientific base of this? Like that, they denied permission. The teacher, biology teacher
Yeah, yeah. Yes, 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 yes.
of
They deny only.
then.
Yes.
So it's a sorry state where biology teacher himself doesn't know about this melatonin, what happens, how it is affecting the regeneration capacity of the body, how students are getting affected while they stay awake late at night, all these things. So I had to send around some 20 research papers from 1982 to 2022 to convince him
Oh,
that this is a fact, that when you expose your body to artificial light, the melatonin production decreases, and it will ultimately affect your health. So this
yes.
is something we all need to create awareness about these small things about among students, and prepare a strong,
Yes.
healthy
Yes,
next
yes. And
generation.
I'm working on the majorly, especially on the girls, actually, very frankly speaking, because what I found is they are having very low HB. And the present scenario is that they are very much yeah, thinking of their only figures, that maintaining all that things. I told that is not important. Your health and your strength is important.
Yes,
If you have the good strength, then only you can have good mind.
yes,
Yeah, otherwise you cannot have a good mind also. And a few of our students, as I said, that they are working now, they are telling us, no sir, as we are working from home, That is, we are having lots of problems now. Eyes problem we are getting now, back pain problems. So please suggest some asana. So I told you, perform at least for half an hour or 1 hour early morning, some good things. And whenever you get time, you just get move around here and there. Don't sit for more time at one place, and have the movements of your all body parts. Because body parts movement, if it is not then it will stop working.
Yes.
Very frankly speaking. So we have to make them alert in that case.
Great. Thank you so much for sharing these things, and keep up the good work.
Yeah,
sir.
Bhaiya.
Prashant ji.
Yeah,
Thank you.
yeah. Thank you, Bhaiya. Thank you so much.
Parikshit Bhaiya.
Namaste, Sundar Bhaiya. Sundar
Namaste.
Bhaiya, it was really lovely listening to you, and it's really, I should thank Prashant Bhaiya also for his sharing, because his sharing really an inspiration for us also.
True,
Because
Manoj.
this way we can also do certain experiments, some kind of things we came up. Yes, this can also be done.
Yes.
So, so thank you, Bhaiya, for being there and guiding us at every step. And yes, to check our breath and all these things, this are really, really, really very important, and we are lagging behind that. So I hope with your company, we will keep on reminding ourselves to please have a look on your body and do
Yes.
something positive towards it. So with this note, Bhaiya, if with your permission, I say I
Yes,
believe
Manoj. Yes.
we can call it a day.
Yeah.
So thank you, Bhaiya. Namaste. And
Namaste.
thank you to all the participants who are there asking questions and patiently listening to Bhaiya. So hope have a happy and healthy life. Namaste to all.
Namaste.